Anatomy physiotherapy provides three things principally. Physiotherapy, which is the repair of people's aches and pains really, joint aches and pains as well as nerve aches and pains and bone aches and pains. We provide massage therapy, which is slightly different. That's more soft tissue massage, Swedish massage. We do massage to get rid of people's swelling. We do massage for people's muscles and nerves specifically. And then the other thing we offer is something called rehabilitation or physical rehabilitation, which is the rehabilitation of someone that wants to get back to activity. So as an example, if we had a footballer coming in or maybe a golfer coming in, our objective is to repair the tissue damaged and then to work on the tissue to maximise it, to strengthen it, and more importantly, get it ready so we can return the person back straight to sport or functionality. What we're very good at, because of the level of experience that we have and the quality of the therapists we have, not only do we help patients with aches and pains, but we try and get to the cause of what the problem is. Whereas some clinicians will give them pills to reduce their symptoms, we give them treatment to recover the problem, but more importantly address the problem to stop it from coming on again, which I think is really, really important. So as an example, with back pain there's a reason why people have back pain, there's a reason why someone would have knee pain, and if you don't get to the grips of what the cause is, then we can do the treatment and then it will come on again. Patients are wasting their money. So our objective really is twofold: treat the patient, get them better, but more importantly address the cause, otherwise it will come on again. Secondly of all, we get a lot of GPs that refer to us. We've got a very good relationship with a lot of the GPs within a good 3 or 4 mile radius of us. We work with some of the NHS GPs as well as the private GPs. They know us, they know our quality, and more importantly, a lot of patients go back to them and tell them how good we are, and then that gives us more referrals.
We do get a lot of referrals from consultants. GPs recommend their patients to come to us, so we have got quite a lot of good word of mouth, around in the community. But also a lot of people come from friends recommending them already coming to the clinic, family members or passing trade. They'll just see us off the street or on the internet. So there's numerous ways that people come, and people come and just pay as you go. If you're self-paying, not for insurance, you can just come, just walk in the door.
87% of all patients that we see on a daily basis are recommended to come and see us by someone, which is excellent work. And we don't tend to do any marketing in newspapers, we don't advertise in surgeries, we don't put out big billboards. We go purely on our reputation, because I firmly believe if you've got good physiotherapy and good rehabilitation and good treatment generally, not just in terms of the treatment but the way you're treated, I find that they will go out and they'll tell a few other people. So our philosophy has always been treat the person and the referrals will come in exponentially from that. I have 3 or 4 clinics actually. So this clinic is the main one in Harrow on the Kenton Road in Kenton, northwest London.
Physio, and then they spend a certain number of weeks with them, training and learning about physio, and then they go off to university to finish their course. They like it. They will send us a card saying they really liked it here. Get loads of cards from the students. Hands-on, actually seeing firsthand how physio is. A lot of people, the students come in, they're not sure about physio, then when they see it hands-on, they realise what it really entails.
And how to take what they learn from the classroom and put it in practice. It's huge.
I mean, in university they probably learn from dummies, don't they? And here it's actually hands-on.
We all work as a team, even management. Everybody feels like it's one happy family, really. The clinic is never short-staffed. There's always somebody to fill in. So it's a nice feeling.
It's nice, really friendly. Staff are really nice. Physios are really nice.
Everybody, great team.
Yeah.
We all work together really well.
That's the good thing. We all come together.
It's like extended family.
Very welcoming, very friendly, and make you feel comfortable. I think that's important.
She makes me lunch, I like that.
There we go.
We get on very well. Everyone gets on really well.
It's a nice boss. A lot of the clients we've had are the clients that have been coming for a long time, and then they recommend people, which is always a good thing. They really like the physios, they like the treatment, which is why they stick to the same physio that they want.
At Christmas we get inundated with chocolates and biscuits. Inundated, like.
So you can tell that they're pleased, and when their treatment finishes, then they'll always send us a card and thank us that they had, they were treated really well.
Generally, we get really, really good reviews. We get people leaving with a big smile on their face as much as they can if they're in pain, and very, very good feedback. People will come out and say, "Oh, that physio is wonderful." One patient said to me one time that if I were asked to score out of 10, I'd give it a 12, and things like that. So that's really good to hear. And quite often they get a lot of feedback saying, "Oh, you're so much nicer at reception than at GP surgeries," and things like that. We do try and get a personal touch.
It's a good feeling when patients come out from their treatment and they tell you how well they've been treated and also the help they receive from the physios, and so it's a good feeling.
I came here about 4 or 5 years ago when I had a knee problem and I was referred to by the GP. I have been to few physiotherapists privately, but I haven't been to a proper clinic before. This is the only one I have been to in the past, and I completely trust it.
So I would recommend this place to my friends, and I have already done so.
The clinic itself, I think it's very efficient. Yes, it's run well. I've been to a few other clinics, and I think this is a well-run, well-managed, friendly. Everyone does their jobs, and that's the main thing.
I think they are very, very professional, and they know the subject very well. So I think they are very well, the experts in their field.
Come to Anatomie, it's wonderful, and they'll look after you.